Drea, could you introduce yourself to me, to the
Hi.
audience?
Absolutely. Hi, Mike. I'm Drea Salas, and I'm the chairwoman for Women Grow Dallas.
And could you tell me a little bit about Women's Grow?
Women Grow, we started our chapter in August of 2015, and it was the first of its kind in Texas, and it's based out of Denver, and it's designed to connect, educate, and inspire women and men in the cannabis industry. Whether you're a patient who wants more information or someone interested in entering the cannabis industry.
Okay. What do you find your I guess biggest challenge here in Texas, particularly in the cannabis industry?
Absolutely, Mike. We do have a lot of challenges. It is going to be the largest market in the United States. Texas will soon be, but it's still very prohibited here. It's very taboo. We are still dealing with the attack on the war on drug, what it's done to many communities. But we're in the Bible Belt, and it's not a normal conversation to have with someone about their health care options. What are some options for them outside of just regular pharmaceutical? Cannabis is a plant-based medication, and how can you, in a state that doesn't have any culture of cannabis, how do you start having those conversations with people? Not just your family, but lawyers and doctors and nurses and teachers, and start opening up that dialogue.
Well, how do you do that?
You ask, what do you think about using cannabis as an option? You have people who have Crohn's disease. You have people that have chronic pain, from children with epilepsy to parents who are dealing with an autistic child. They want a better quality of life. And so you start that question, what would you do to improve your quality of life?
Thank you. I noticed that you have a consulting business in cannabis. Could you tell me a little bit about that?
For sure. It's Healthway Education Systems, and I've been in the industry for over 2 years, Mike, and what was consistent was the lack of information or credentialed information for someone who may want to get into the industry, most especially healthcare providers. So we created Healthway Education Systems, where we offer continuing medical education for medical professionals, nurses, psychologists, and other healthcare providers.
Okay. And what kind of reception have you gotten with that in the medical community here?
They have responded. It is that question, as opposed to, hey, go Google some information, to, we have something that we can offer you to get more information so that you're equipped to answer more questions when patients are asking about, could cannabis work for me?
And how did you get into the industry?
Well, funny enough, I got into the industry well over 2 years ago. I've always been a proponent for the freedom to be able to choose your quality of life, not necessarily abuse any form of drug, whether it's an opioid or other. But my mother she recently died, but she was very, very ill. And I wanted her to have a quality of life, not just taking 26 pills. And she was a chronic smoker. So what could I do to help improve her quality of life? I became her caregiver. I introduced oil to her. I introduced cannabis and marijuana to her. She became my biggest fan. That this 70-year-old woman who was from Louisiana, where there's no culture of cannabis, is saying, this is what I could get in trouble for. This is what's going to also make me have a better quality of life. And that's what started it for me.
I know where you're coming from. I've been a patient myself for 21 months, but I've been a fan of it since I was a teenager back here in Texas. Since then, that was 14 years old. So I know where you're coming from. Well, thank you, Drea, and I'm sure our viewers will really enjoy this interview. Thank you again.
Thank you, Mike.